Welcome. Today we're diving into a condition called gastric outlet obstruction, or GO. It's a blockage that prevents food from emptying out of your stomach into the small intestine. Understanding GO is crucial because it can significantly impact your health and well-being. Let's explore what causes it, how it affects your body, and what can be done about it. So, what causes this obstruction? The etiology of GO is diverse. In adults, the most common culprits are peptic ulcer disease, specifically ulcers located in the pylorus or duodenum, and gastric cancer. These conditions can lead to scarring and narrowing of the gastric outlet. Less frequent causes include pyloric stenosis, which is a congenital condition in infants, benign tumors, inflammatory conditions like Crohn's disease, and even certain medications or foreign objects. In some cases, previous abdominal surgeries can also contribute to the development of GO through adhesions or scar tissue formation. Now let's look at the pathophysiology. Imagine your stomach as a mixing bowl. When GO occurs, this bowl has a blocked drain. Food and gastric juices can't pass through the pylorus, the opening to the small intestine, as they should. This leads to a buildup of contents in the stomach. The stomach tries to compensate by contracting more forcefully to push the contents through, leading to gastric hypertrophy, an enlargement of the stomach wall. Eventually, the stomach can become severely distended and unable to effectively empty, resulting in the characteristic symptoms of GO. Gastric outlet obstruction isn't a particularly common condition, but it's not rare either. The exact epidemiology varies depending on geographic location and risk factors such as rates of peptic ulcer disease and gastric cancer. It tends to affect older adults more frequently, given the increased prevalence of contributing factors like peptic ulcers and cancer in this age group. However, GO can occur in people of all ages, including infants with congenital pyloric stenosis. What are the signs and symptoms of GO? Early on, you might experience nausea, vomiting, a feeling of fullness after eating only a small amount of food, and abdominal discomfort. As the obstruction worsens, the vomiting becomes more frequent and may contain undigested food from hours or even days prior, a sign of delayed gastric emptying. Other symptoms can include abdominal distension, weight loss due to inadequate nutrient absorption, dehydration from persistent vomiting, and even metabolic abnormalities like hypokalemia, low potassium levels, caused by the loss of electrolytes in the vomit. A characteristic splashing sound, called a succussion splash, may also be heard when listening to the abdomen. How is GO diagnosed? The diagnostic process typically starts with a thorough medical history and physical examination. Imaging studies are crucial. An upper endoscopy allows a direct visualization of the stomach, pylorus, and duodenum to identify any obstructions or abnormalities. A barium swallow or upper GI series can help visualize the flow of contrast through the digestive tract and pinpoint the location and severity of the obstruction. A gastric emptying study measures how quickly food empties from the stomach and is helpful in confirming the diagnosis and assessing the degree of gastric emptying delay. Finally, biopsies taken during endoscopy can help rule out or confirm conditions like gastric cancer. While not strictly classified into distinct types, gastric outlet obstruction can be broadly categorized based on the underlying cause. For instance, GO caused by peptic ulcer disease is different from GO caused by gastric cancer. The approach to treatment and management will depend heavily on the specific etiology. The treatment and management of GO focus on relieving the obstruction and addressing the underlying cause. Initially, managing dehydration and electrolyte imbalances is crucial. A nasogastric tube may be inserted to decompress the stomach and remove accumulated fluids and food. Medications like proton pump inhibitors, or PPIs, can help reduce stomach acid production, especially in cases related to peptic ulcers. The definitive treatment often involves either endoscopic or surgical intervention. Endoscopic balloon dilation can be used to widen narrowed areas caused by scarring or strictures. In more severe cases, surgery may be necessary to bypass the obstruction, such as a gastrojejunectomy, which creates a new connection between the stomach and the jejunum, part of the small intestine. Or, if the cause is cancerous, surgery to remove the tumor may be required. Nutritional support, often with intravenous fluids, is also an important part of the treatment plan. Unfortunately, there's no guaranteed way to completely prevent GO, but you can take steps to reduce your risk of developing contributing factors. Managing risk factors for peptic ulcer disease, such as avoiding excessive use of NSAIDs and treating Helicobacter pylori infections, is important. Adopting a healthy lifestyle, including a balanced diet and avoiding smoking, can also contribute to overall digestive health. Regular medical checkups can help detect and manage potential problems early on. The prognosis for GO depends largely on the underlying cause and the success of treatment. Benign causes, like peptic ulcer-related scarring, often have a good prognosis with appropriate intervention. However, GEO caused by gastric cancer carries a more guarded prognosis, depending on the stage and aggressiveness of the cancer. Recent research is focused on improving endoscopic techniques for dilation and stenting, as well as developing more targeted therapies for gastric cancer. Continued advancements in medical and surgical management are improving the outlook for individuals with gastric outlet obstruction. If you suspect you have GEO, seek medical attention promptly. Early diagnosis and treatment are key to a better outcome.